Okay, these are the things we're going to cover. Okay, supplements. People always come in and say, you know, will anything help me? Should I be taking vitamins? Should I be taking supplements? And actually, it is very important to include certain types of nutrients to the diet, as well as consider supplements. Very important to include antioxidants in the diet. That's vitamin A, vitamin C, and vitamin E. This is accomplished by eating lots of fresh fruits and vegetables. It may also be helpful to add those supplements, which can stimulate hair to grow better. The most important extra supplements to take include biotin, which is a B vitamin, zinc, copper, again, along with the antioxidants. The latest research has shown that some omega-3 healthy fats can also improve hair growth, quality of hair, and the amount of hair grown. And also, recent research suggests vitamin D is also very helpful. One supplement that we do recommend is something called Nutrafol. There are other ones out there, but this one in particular seems to have most of the important extra nutrients that are needed for healthy hair to grow. And what about medications? In certain women, oral medications may in fact be helpful for genetic hair loss. Spironolactone helps block testosterone. Finasteride, which is typically more thought of as a male treatment, but in postmenopausal women it can be helpful. Again, taken orally. There is some research being done on a more topical treatment of finasteride, which I'll talk about in a minute. Certain oral contraceptives can be helpful in younger women. Some contraceptives actually can be harmful to hair, but some can actually be beneficial. And oral minoxidil, which is what's in Rogaine, taken orally, can sometimes help with excessive shedding. If, after being evaluated, we find a woman might be helped by these things, we would certainly work with their primary care doctor to make sure that these are safe treatments for you. Topicals refer to things that you put on your hair to help it grow. There are hundreds of products out there which claim to help hair to grow better. I will tell you that the vast majority of them don't work. And women spend hundreds of thousands, if not millions of dollars a year buying products that are absolutely useless. As part of your medical evaluation at Medi Tresse, we educate our patients as to what can be helpful and what won't work. There are very few shampoos which can actually stimulate hair to grow better. We recommend the trichomen products because they actually have some studies to indicate that it does help growth. Trichomen also has a follicle spray. There are some treatments which can be helpful, which are called DHT blockers or testosterone blockers. But again, most of what's out there does not have anything of value. The most recent research done on a whole new group of treatments called prostaglandin analogs. You might be familiar with the medicine called Latisse, which helps eyelashes and eyebrows grow. There has been some research to show that it may also help scalp hair to grow. So I'm looking forward to some more research which may show that to be helpful as well, but there's nothing available yet on the market. Minoxidil, everybody knows about Rogaine, and it's been around for decades, and it's been researched, hundreds of studies, which do show that it does help to grow hair. The problem is that it tends to cause hair to be kind of greasy and irritating on the scalp, which makes it less useful for women in particular. Fortunately, we've been able to use a formulation called 82M, which combines the latest ingredients, minoxidil, with the addition of retinoic acid and vitamin E, as well as other ingredients which cause it to be non-irritating and does not leave the hair to be greasy. It does stimulate hair to grow. It decreases hair loss. And for most women, it takes about 3 to 6 months to see benefit. It will stabilize further loss and allow you to maintain your hair for a longer period of time. As I said before, we're looking at using topical or liquid finasteride for postmenopausal women in combination with minoxidil, which may be helpful in very specific cases. Low-level laser therapy. Lasers are used for a lot of different types of treatments. What we use here is a low-level laser. I'm sure you've heard of the higher lasers, which can actually remove hair permanently, remove skin lesions. They're used for treatments for some cancer treatments. This is a low-level laser. It's a cold laser. It's incredibly safe, has been studied extensively. The most recent studies that were published in journals within the United States showed that after 6 months of using a laser apparatus every other day, that after 6 months, 95% of patients had benefit, which meant that they had more hairs, a greater number of hairs, stronger hairs, thicker hairs, and it is very safe. There are virtually no negative side effects. How it works is still being studied, but we do know that it decreases inflammation, it increases cellular activity at the base of the hair follicle, and stimulates the hair follicle to grow larger and therefore produce a better hair. There are a variety of devices that can be purchased. We've come a long way in what we can use to provide laser treatments. In the past, you actually had to go to a hair clinic and sit under a very large unit and come back for very frequent treatments, which was very inconvenient. Now you can purchase lasers and use them at home. Most of them you use for anywhere from 15 to 30 minutes every other day. This laser cap is a very reputable company that we recommend. It targets the entire scalp. It is an FDA-approved treatment and has been shown to have benefit. This company also does provide a lifetime warranty, which is very important because there are a lot of lasers that you can purchase online which don't have warranties and don't have the same kind of benefits that this particular product has. Another product we recommend is a laser band, which you do have to move a little bit. It doesn't just sit there. It only takes about 10 minutes to use, which is a benefit. It's very quick, but you do have to move it every few minutes to target specific areas. As I said, lasers are incredibly safe. There are no real side effects associated with it. And it's a cool laser. It doesn't create any burning or heat to the scalp, and it is shown to be significantly beneficial for treatment. Platelet Rich Plasma, PRP. PRP is the newest form of treatment for hair loss for women and men as well. It's used for a variety of treatments in the medical world, including hair loss. It's also used for orthopedic injuries. We're seeing it being used for dental work, for ophthalmologic work. But in terms of hair, it's a new and exciting treatment which helps hair to regrow at a much rapid rate as compared to some of the other treatments. It's important to know that PRP is very helpful in the right patient. It is important to have a careful medical evaluation to find out if you are a candidate for PRP. Again, it doesn't work for all types of hair loss. It's extremely helpful for genetic hair thinning, but it doesn't work for everything, which is why, again, a medical treatment evaluation is important before considering having PRP treatment. We have decided to use a schedule of 1 treatment a month for 3 months. We have found that this works really well. We also have the ability to add additional stem cells to the treatment if the patient would like that added. The stem cells do seem to accelerate growth at a faster rate, but it's not necessary for PRP to work, but it is an added benefit. What is PRP? PRP stands for Platelet Rich Plasma, and it utilizes the growth factors that are found in your own blood, which can be then injected into the area that needs treatment. Wherever that PRP gets injected, where the growth factors go, will stimulate growth. So we know that in hair, It stimulates the dormant or the small hair follicles to grow, makes the hair healthier, fuller, stronger. Studies have shown that up to 85% of patients experience new hair growth and increased hair diameter after PRP treatments. That is consistent with our experience as well. It's been found to be helpful, especially in androgenic alopecia. It does work for the traction alopecia, which is the hair loss in the front, which is a result of pulling, and in some cases can be helpful for alopecia areata, particularly in focal areas, smaller areas. It's very difficult to treat the entire scalp for alopecia areata, but it can work for focal areas as well. So everybody says, what can I expect during a treatment? The actual treatment takes less than 60 minutes. We take a blood sample just like you're having a blood test, and the blood is then spun in a centrifuge and the blood levels separate. The platelet rich plasma that has all the growth factors in it is then separated. The scalp, wherever the treatment is found to be indicated, is a local anesthetic is administered to numb the area. The PRP is then administered to the scalp through a series of injections. We do also create microtrauma to the area, which also stimulates the growth factors to work. And the actual procedure, as I said, takes considerably less than 60 minutes. And after the procedure, recovery is pretty much uneventful. Once the anesthetic wears off, the pain can be easily managed with a little bit of over-the-counter Tylenol. We don't recommend ibuprofen, Motrin, or Aleve because that actually can interfere with the PRP function. You can have some mild swelling for about 4 to 6 hours after. Again, this usually resolves within a couple of days. Everybody drives themselves home. You can shower and wash your hair the next morning. It's a very simple procedure and very, very well tolerated. I'm going to show you a series of pictures of women who've had PRP. And the other thing that's important to recognize, and you'll see that as we go through these photos, is that the majority of people will do PRP, will also do other treatments, oftentimes the laser band, the laser cap. We do recommend minoxidil, specifically 82M, if you are going to have PRP, because once the PRP stimulates the growth, we want you to keep it as long as possible. And minoxidil and laser treatments will help you maintain that new growth that you've experienced. So this particular woman had PRP plus with the addition of the stem cells, and she had her 3 treatments and continues with laser band every other day. Here's a woman who had a lot of loss in the front, a young woman, and she also had the PRP plus and continues with treatment with her laser cap. This woman was very interesting. She had a wonderful response to the PRP for 3 treatments. She insisted that she wasn't going to do anything but PRP, despite our recommendations. She did have a wonderful response with PRP, and we're still trying to convince her to continue with minoxidil and or laser so that she can maintain this wonderful result for as long as possible. Again, woman with PRP plus continuing with her laser therapy, and also had a really excellent response. Again, PRP plus with the stem cells. Again, the stem cells aren't essential, but what we have found is that it causes the growth to come in a little bit earlier. There is regrowth without the stem cells, but the stem cells seem to sort of kickstart things. This woman had the PRP plus 3 treatments and continues with her laser cap. It's important to recognize and understand that PRP does not cure the underlying cause for your hair loss, whether it's genetic, or alopecia areata or traction alopecia. The PRP doesn't cure that problem. If you have traction alopecia, clearly it's absolutely essential once the regrowth occurs to not do those particular hair care practices which cause the hair to be stressed. Genetic hair loss cannot be cured at this point. The PRP stimulates regrowth, it brings back those hair follicles that are under stress. And the PRP benefits can last anywhere from 1 to 2 years. Some research has shown as far as 4 years, but I think that's less common. So it's important to understand that additional PRP treatments are very likely to be necessary in the future. Generally, we recommend anywhere between 1 to 2 years to consider having a booster, which is just one treatment, and to be monitored very carefully. Again, this is where the importance of the medical evaluation comes in. We at Medi Tresse follow our patients very carefully, make sure they're getting the best response possible, and maintain a relationship with our patients to continue treatment indefinitely. Because again, we cannot cure this, we treat it like any medical problem, whether you have high blood pressure or diabetes, it needs continued monitoring. And that's our goal at Medi Tresse. Very important that you get continued treatment. Hair transplants for a long time were the only treatment offered to women with hair loss. And it's a treatment that does work. It's a permanent treatment, particularly for genetic hair loss for women who are very good candidates. The problem is that you need to have good donor hair, and a lot of women with genetic hair loss don't have good donor hair. And how transplants work is hair that is stronger, particularly in the back, is actually removed and then transplanted in the front. And this woman had a very good response. Her area of thinning was filled in. But again, even after transplant, the hairs that have been transplanted will stay strong, but the hairs around it, which are genetically destined to continue to thin, need to be monitored and treated again with laser and or minoxidil. I personally recommend both. They work very differently. Minoxidil and laser work very differently. It's like taking 2 different medications for your high blood pressure. They work differently to accomplish the same result. So whether you have a transplant, do PRP, it's important that you be managed and monitored carefully and additional treatment be continued. I also think that in some instances, medications are important in young women, particularly hormonal therapy is important, and additional supplements like the ones that we mentioned, Nutrafol, and other vitamins can be very helpful as well.